Hi everyone, this is Professor Nugas, and today I'm going to teach you a lesson on management of care because I know many students fail this content. And remember, this content is on more point, okay, than uh, the other content. Okay, let's start. First of all, I am going to go to the ebook, okay, to the ebook, the real Nclex review question. So after you watch this video, what you can do is write your name and your email address on the commentary space so that we can organize a Zoom meeting together, and then we can I can teach you some lessons. Okay, so sometime every Sunday I can teach you Nclex lesson. For example, by 3 p.m. we can organize, some lessons. So if you write your name and your email address, I will be able to uh, send the notification to you. Okay. So let's start. First of all, let me go to the Amazon to get the book. Let me click. And then what you're going to do, write Amazon. So it's open. And then you can type the title of the book, which is Real and Correct Review Question. It's not difficult. And then press enter. So this is the book right here, Real Nclex Review Questions. So what I'm gonna use it is the Kindle. I'm gonna use that. Okay. If you buy this book, you just need to click it on the book and then you buy it. It's $9. It's free. Okay, $9. So let's start. I'm gonna click Kindle because this is what I'm gonna use today. So, and then when you click Kindle, you will see read simple. So we're gonna answer question on the simple. Okay. So let's start. Start. Boom. This is the book. So let's go over the content. This is the introduction. Okay, this book has 240 questions and answers. Okay, and then you will see also the scenario or the scenario question where you can answer. Very important. I like this book. So let's go over some questions for you. Okay, pay attention closely to this question. Develop your skills. So let's start. First question. Which of the following tasks is appropriate for a nurse to delegate to an unlicensed assistive personnel? So we're talking about unlicensed assistive. What those people can do? That's the question they ask you. First, part A, administering oral medication. Can an unlicensed person give medication? No. Second, performing a sterile dressing change. No. Sterile? No. C. Measuring and recording a patient vital sign. This is the appropriate choice. So because this is not dangerous, okay? So to check the vital sign. So that person can do that. D. Assessing a patient pain level. So the question is which of the following tasks is appropriate for a nurse to delegate? So the, the best choice for this question is C, measuring and recording a patient's vital sign. That's number one. Any question, guys? So often when they ask you a question, remember the answer is in the question. Okay, let's start for the question 2. Question number 2. Which of the following patients should the nurse see first after receiving shift report? You see this question? That's priority. A lot of students get problem with this question. So priority, which patient you are going to assess first. So let's see. Make sure you assess the patient that is get more percentage to die. You assess that patient first. Okay? A patient scheduled for discharge who need medication teaching. This is not too important. No, it's not dangerous. Second, a patient who is complaining of shortness of breath. You see this one? This is dangerous. If you do not assess this patient, if you do not care for this patient is gonna die. Yes. Basically, you can continue to read the questions, the answers, but basically this is the answer. C, a patient who needs assistance ambulating. This is not important at all. D, a patient requesting a sleeping pill. So as you can see, the best choice for this question is B. Okay, B. Because remember, do not select a choice to kill the patient. Do you understand? So this one, if you do not select a B, you're gonna kill the patient. You need to select B. Okay. Let's go for the question number 3. Which of the following is an example of breach of patient confidentiality? This question has a very important key to understand. What is the important key? The breach of patient confidentiality. The breach means when you violate the rules, you violate the law. So the choice I am going to pick right here is the fact that the question says which of the following is an example of breach. I am going to select a choice that breach the patient confidentiality. Okay, so let's start. First, discussing a patient condition with the healthcare team in a private office. That's not too bad because it's a private office. Okay, yeah, that's not too bad. Okay, don't take this one. Second, sharing a patient medical information with a colleague not involved in the patient care. So you see the shows? This exactly breach the confidentiality. It breaches it because it's sharing a patient medical information with a colleague not involved in the patient care. So you can understand. C, using a patient initial instead of full name when discussing their care. That's not important. D, providing information to a family member with the patient consent. This is not important. The only choice if you don't do it, you violate the law, is sharing a patient medical information with a colleague not involved in the patient care. If you do this, you violate the law. Yes, you violate the confidentiality of the patient. Therefore, B is the answer. Remember how to choose the answer. Remember, be smart. Let's go for number 4. A nurse receives an order to administer a medication that the patient is allergic to. What is the nurse's best course of action? Usually they ask this question. Usually. You cannot go to the test and not having this question. You will have it. Trust me. Okay, they say a nurse receive an order to administer a medication that the patient is allergic to. What is the nurse's best course of action? What the nurse must do? I administer the medication seen it was ordered by the physician. No, even it's ordered by the physician, you cannot do that. B, ask the patient if they have had this medication before. No, that's not important. C, hold the medication and notify the physician of the allergy. That's exactly the best choice. Hold the medication. Don't do it. Don't give it. Okay? Do not give it. Hold it. D, administer a lower dose of the medication. This is crazy. You cannot give out all the medication. D is not in that. Okay? Very important. So what is the answer? Hold the medication. C is the answer. Very important. Question number 5, which is the last question. A nurse is prioritizing care for a group of patients. Which patient should the nurse attend to first? That's priority. Make sure you know that. Priority. Let's see which patient the nurse must care first. A patient with a blood glucose level of 150 milligrams who is scheduled for a meal. It's not too important. No. B, a patient who has just returned from surgery and is experiencing increased pain. Oh, you see this? If you do not care for this patient, he is gonna die. This is emergency. You need to take this choice. Remember? C, a patient who needs assistance with bathing. Wow, that's not too important. You cannot choose this. D, a patient who is requesting a diet change. That's nonsense. Therefore, the best choice is B, a patient who has just returned from surgery and experiencing increased pain. Hey, listen, if you do not care for this patient is going to die soon. All my student, nurses, make sure you practice this question. I just give you a taste of this book. What is in this book? Okay, this book has a full of questions, very important questions. I know you're gonna see them in your test. Practice. Be at ease when you practice. Okay? Listen. Practice, you will pass. Buy the book. It's a free book. It's $9 only. I make it free for you guys. I need to help you. Okay? Just go to Amazon and then type real Nclex review question. And then the book will pop up. Okay, very important. All right, students, remember to write your comment and then under the video or below the video, write the comment, but do not forget to write your name and the email so that we can organize a Zoom meeting together where we're going to teach you more questions. I want you to pass the Nclex. I want to change your lives. Okay? I want you. Yes. Thank you very much. Have a good night.